Are we finally seeing some consistency in the inspection department where we seem to have been in flux or short for people in some cases? And I mean, we from everything that we've been through in the last couple of years, as far as looking at the numbers, it's been all over the place. So
Consistency as, you mean, as revenue, or consistency as bringing in the public and getting inspections done and handling the day-to-day operation?
one actually leads to the other one. So I was going with the second one you talked about, but it actually leads to the first one, which is revenue. So I just, as far as consistency, getting to the jobs, having the people in place to get to the jobs, just some consistency in the department.
I can tell you, I've been here about 7 months. I've heard a lot of stories about what went on before I came here. When I got here, what we have in place with the existing building inspector, wiring and plumbing inspectors, we have some pretty good people in place. And I can tell you, since I've been here, and I think even before I got here with the people that were here when I got here, everything's been taken care of adequately and the way it's supposed to be taken care of. Since I've been here, I try to implement some new policies that have worked for me in other locations where I've worked. And I think we've made some strides and some progress, and I think people are more comfortable to come to our counter and apply for permits, and we're doing adequate inspections, and I haven't heard any negative feedback so far.
I'm just curious, do you have a interval between a request and an action or response that you have to live within?
Plumbing inspector has 72 hours. Wiring inspector has about the same. We have 24 hours, but we usually do the inspections the same day they're requested. Only because we're properly staffed as far as inspectors right now. My concern moving forward is that we may not be. But right now, we're handling all our inspections on a very timely fashion.
So there isn't a backlog, or you haven't got people?
None whatsoever. If we have an inspection request on Monday, if it's not done on Monday, between Paul and myself, it's done on Tuesday. No one ever waits for an inspection.
Good.
Any other questions? Give us a minute as we're looking through the numbers. Could you just break out purchase services and professional services out of the line item budget?
With our professional services account, most of that goes to our weights and seals measures. Gentleman, Jack Savastano, he gets paid by the hour. So a majority of that fund is directly related to his salary, if you will. He's paid on an hourly basis. The rest of it goes to alternate inspectors who fill in for electrical and plumbing inspectors when they're not around or when they're on vacation. Purchase services, basically we use that for office repairs, inspection equipment. We use some of that for vehicle. We have our own vehicles in our department, so we repair our vehicles when it comes time for stickers and major repairs. And we also pay, it's a minimal expense, we pay our water. We have water there too, so that's where that money gets spent. Office repairs, inspection equipment, vehicle repairs.
Thank you. So the big question is, at this point, you think this budget is adequate to fund the department?
I do not. I think
Okay,
it's a
tell me what else tell me what you're not doing, what we can't afford to do, or what you'd like to do.
I would like to, and I've discussed this with Derek, what you see in front of you is a level funded budget. It's the same numbers as last year, which if we're going to move the department forward and we're going to really handle some of the things that we haven't been able to handle, like collecting of information, filling street files, bringing all the adequate information and doing the adequate things that we need to do. Right now, the plumbing electrical inspectors do all their own secretarial work, which takes them out of the field. They process their own deposits, they bring in all their inspections, they do all their permitting on their own, they even do their filing and computer entries on their own. What the department lacks is, the biggest thing it lacks is we have one secretary that helps all the inspectors. It's really warranted for two So in the future, hopefully the near future, we can bring on a second person, whether it's part-time or full-time. To answer your question, we can maintain the level of service we have today with a level-funded budget. But in order to move the department forward and to do some of the things that the state mandates us to do, along with all the FEMA things that we're dealing with, all the floodplain regulations, first and foremost, we would need some more office help.
Okay.
Okay, one more time. I know one thing we don't get normally with this is a list of revenue or revenue generated through the fees and whether, do you have something along that line so that we can, I mean, what are we looking at as far as the fees and other, well, I guess it'd be permits fees that are going to be charged during 2015? What does that equate to? Is that going to be up in our page 1 there, Derek?
Yeah, for the budget up there. I remember, let's try and pull the documents that we had last year on there.
Yeah.
I mean, when you look at the licenses and permits, that's also the Board of Health and the Selectmen on there as well, which can be several hundred. I think your department represents about 400,000, or is it a little over that, or?
I don't have exact numbers, but obviously the revenue is going to be driven by the economy. So, smaller projects, if we make this department user-friendly, we're going to bring in all the little projects that people try to get away with without getting permits for now. So that's what my goal is coming in here, is to make it more user-friendly, make it simple for people to come in, make the permit process easy, one-stop shop, if you will. That will certainly increase our revenue. But as far as the big ticket items, like we had the hotel come in recently, we have some other bigger projects. We have Walmart, they're coming in. Those are economy driven, so it's based on what the town does proactively to generate these kinds of projects. That's going to affect our bottom line.
Okay. Is that it?
You just got the easy.
I was going to say, you're easy. That's it.
I mean, I'll do the best I can. I know this is the first time you see me. I'm sure you have more questions, but
Well,
if you want to let me go off easy, then I'll certainly will.
If you showed up at about 9 o'clock, you've been here for an hour and a half. At this point, we thank you very much for your time.
Yeah, and I would say, and I don't mean to prolong this, but if you stop by, take a look at the office, and you can visually see the changes in there of the professionalism. So I appreciate what Mr. Iafredi and his staff have done.
I don't want to take up any more of your time, but when I first came here, just the first time I walked in, I looked in the room and I'm like, wow, this is really antiquated. We had, everyone had a different style desk. The walls were all beat up. There was stuff thrown all over the room. We had 3 different locations where we had files, 3 different rooms, and they weren't together, so you couldn't find a file if you're looking for a file. And that's a lot of things we do is we're record keepers, and a lot of times we service the public. People who want to buy houses, they want to see what the history was of the location. A lot of real estate people come. So if we don't have that information handy for them, it wastes a lot of time. So with the help of some of the people in town, in my department, we've painted, we've put a new rug in, we've actually expanded into an adjacent room where we now have all our files in one room. We're not done yet. We're running out of money. We're trying to, get some donations to finish the ceiling, and I'm, actually doing painting on my own. But it just, when people come in, they see that, it's much more professional, and it's more comfortable to work out of that. So all my people are very happy. We have a little bit of a change of venue, and hopefully we can continue and we can retain these people, and we can continue to make the public happy and do what we need to do.
and we don't mean to make light of that. We very much appreciate that. We were all well aware of the problems that were going on and the results of our insurance ratings and issues that have come out as a result of that. And we hope that at least in your department, we're on the right track now, so. It seems
so.
that way, and we appreciate that, so, thank you.
Thank you.
Oh, one more.
How come part-time as opposed to full-time in those electrical and plumbing?
Funding, as far as I know, funding. They'd love to be full-time if we could fund the position full-time.
in the professional services, the 26,000, that's when, that you bring in when they're on vacation or whatever?
We have assistant plumbing and wiring inspectors, plumbing, gas, and wiring inspectors. We have, I think, 2 in each department. So when Jimmy and Timmy are on vacation, or if they're out for some reason, sick or whatever, and we have to cover that position, those people get paid out of that account. But the majority of that account is used for Jack Savastano, who does the weights and seals. I would say, I think 15 or 16, most of that goes directly to Jack Savastano's, salary.
So he's kind of like a subcontractor himself, so we're not carrying him as an employee, is that correct?
That's correct.
Right, no,
Okay.
no benefits on there. His revenues, there is a separate account that they go to. It could not cover the, his, it's not really salary or wages, but let's call it his cost.
Yep.
But it can offset some of the expenses of the weights and seals or whatever he needs for equipment, so.
Are there sensors coming along that are going to do away with the need for weights and measures person?
That's a good question, sir. I'm not sure. I mean, that would be a good idea. We could probably share one, like county-wide or region-wide, but I haven't heard. Have you heard something?
I mean, it's inevitable. We ought to at least be in touch with what's out there, what people are doing to see if.
I know most towns have their own weights and seals measures. So, I agree. I think a change is warranted. I'll look into that.
You see a white pickup bearing down on you after that statement, watch out.
Someone still has to administer it.
Yeah.
Stamp on it.
Yeah,
That's it.
that's true.
So, thank you, Bob.
Well done.
Appreciate it.
Thank you very much.
Hi, I'm Bob Ethier. I'm the health agent for Wareham Board of Health. Mr. Chairman, members of the committee, town administrator, I brought just a few handouts for you just to explain something of what we do. I'm sure, I think there's 2 new people here. Four? Nice to meet you all.
We just looked
You,
at it.
yeah, you all look the same after a while. So.
Yeah, you know, I speak at a lot of different menus.
Oh, I'm sorry, you have to just bring closer.
But I think everybody's nervous when they got to go before the finance committee. I don't know why, but it's always that way. So I'll just tell you a little bit about what we do real quick. In the front page of the handout, our responsibilities include subsurface sewage disposal plan review. That's Title V systems for the areas that aren't sewered in Wareham. Chapter 2 housing inspections are like the new inspection program that we have. It's a state code that we follow for inspections of houses and rental houses. There's Chapter 2 of the state sanitary code, which is minimum standards of fitness for human habitation. And we do motel and swimming pool inspections, seasonal beach water testing at all public and semi-public beaches, restaurant and food inspections. Just a little bit about, we experience an increase in activity of installations of septic systems over the last couple months, which is a good thing. Things are moving a little better. I was told that you might be interested in the regulations that establish boards of health. And the town accepts provisions years ago to establish a board of health, and that's under General Laws 41, Section 1. Just saying that they established a board of health in the town of Wareham like they do in all towns. We enforce Title V, which is the standard requirements of the siting of septic systems. Housing code is what we talked about, minimum standards of fitness for human habitation. And we also enforce the federal food code 105. 490, Article 10, which is minimum standards of fitness for food establishments. So that's what we do. We have quite a few food establishments in Wareham. We're up to about 250 permits. We also oversee tobacco. We oversee the sale of tobacco. We promulgated regulations that when a sting is done by the Cape Cod Tobacco Program, which we just had one in December, we write the letters, we bring them before our board, and we fine them according to how many violations they've had. So for selling to minors, for smoking in the workplace, we're the guys that fine the people for doing that. In the second page, budget review, the housing inspection program is doing wonderful. I remember some board members spoke to you a few months ago about that program and how we thought it was going to help us keep on the people in the office that we need, and also clean up the town and limit the number of inspections and complaints that we do. We're up to about 600 now in the first 6 months of this year.
600 complaints?
Housing complaints, yeah. So it's pretty drastic. It's from failure to provide adequate septic systems, failure to provide adequate heat and electric in a place that a person is renting. It's a landlord-renter relationship. And it could be, in the opposite case, in some of these, it's the tenant who is not fulfilling his part of the issue. So program income now is $35,000. Inspections registered about 350, but they change daily. They're coming in. We have a deadline at the end of January. We hope to have everybody registered. I don't think that's going to happen, but we have a lot of people who are still adverse to this regulation. Plymouth County Emergency Preparedness Coalition. 11 years ago when I got here, I joined the coalition, which is the Preparedness Coalition. It's the Plymouth County Health Departments, somebody represented from each town in Plymouth County. Through that, and by achieving the goals given by the state, the CDC, and the Department of Public Health in Boston, and preparing for disasters and establishing emergency dispensing sites, and we've done everything that we can. Through that, we get money for the accomplishments that we make toward disaster preparedness. For 10 years now, we've had our cell phones paid for. They pay for our bills. They pay for all the computers in my office. They pay for any outside equipment that I need, life jackets, boots, whatever I needed, because a lot of times I'm called out on oil spills or whatever, and that's part of the disaster thing.
We pay for it.
What's that?
Taxpayer pays for it.
Yes,
not
taxpayer
there.
pays for it, right.
But we, the
my
town,
po-
don't pay for it, so.
Right, the town doesn't pay for it. It's paid for
You're not
by
double paid.
CDC funds. It's federal government money.
I can assure you Bob pays taxes as well, so.
Yeah, thank you. So, my point is that funding is drying up. In the next year or two, the CDC has decided, it's not written in stone yet, but they think that they're going to go to the local hospital groups, give them some money instead of giving it to the Plymouth County coalitions, and they're going to establish where the money goes. Now, I'm very opposed to that. They want to go on a regional basis run by the hospital groups, which means if we don't have a good relationship with them, we won't be getting any money for telephones. They won't pay for our telephones. They won't pay the telephone bills. So in the Board of Health now, I have 2 phones, my inspector and myself. And on the next page, this is the Board of Health chart. These are the members of the board, the chairman, Frank D. Felice, members, Glenn Montero, Dr. Amy Vigant, associate member Ken Ferreira, and associate member Kathy Finney. I'm the health agent. I'm a 40-hour position. Richard Johnson currently is a 30-hour position. He's the health inspector. Department head assistant is Suzanne Burke. She's at 37 and a half. Department assistant Dolores Consoletti is 19 hours, and our health inspector John Viveros is 19 hours. John Viveros, I brought him on board when we applied for a grant from the community development. We had that for a few years, and that's the program that we took care of all the inspections and complaints. Now that fund dried up, so that was the reason to start this housing inspection program, to keep him on. So not only do we do the new inspections and get everybody up to par on the inspections to what they have to do according to the code, it also allows us to go out and do the inspections. And hopefully, as you get everybody in line with the code that's renting in Wareham, you won't have as many complaints, and that's what our goal is. So the program's running well, and we hope to be successful with this, as other towns have been. As far as the budget, I can give you a rundown of the budget, and then I can answer any questions you might have for me. You can,
Don't stick the band before you got started. Nope, go for it.
Okay.
Okay. It shows the salaries up top. That hasn't changed. The expenses, repairs and maintenance, that is anything from contracts for our copy machine. We do have a copy machine contract. Ours died a couple of years ago. We got a new one. We're in the middle of that contract. So that's something that we can't eliminate. And that's about even what we do for repairs and maintenance in the office. It could include some type of equipment that we use. It could be something to do with the vehicle. Other professional services, this seems like a lot of money. Other professional services was put in my budget 2 years after I came here, so I believe it was in 2005. They decided to take it out of its separate account and put it in the Board of Health budget. And it looks like we got a lot of money in there, but that's for the VNA service. We don't have a public health nurse because we don't want to pay for all the benefits. So we hire the Cape Cod VNA, and that usually is between $15,000 and $16,000 a year. However, at the end of the year,
Excuse me, what do you have to hire them for?
the Cape Cod VNA is our public health nurses. So we have, during the course of the season, we have 2 flu clinics. We administer flu shots. They do all the disease reporting under the regulations through the CDC and the Department of Public Health. Anybody that has a communicable disease, it gets faxed to our office by a doctor's office or a hospital, and when it's in Wareham, it needs to be categorized through some type of system. We don't have the manpower or the expertise to deal with the diseases in our office, so we immediately fax it over. So that cost also includes
Okay, thank you.
disease reporting to the state, because they got to take it, find out, call the people, find out how they're being treated, and report it back to the Department of Public Health. And also, there is a...
Oh, wait a minute.
Yes, sir?
You're doing it, and also where they're being treated is doing it as well, I'm assuming.
Right. Well, that's just follow-up. The VNA, the Boards of Health are charged with making sure that that gets done.
Okay.
That when they come home, they just don't drop it. So the VNA reports it, they call up the people, they say, what are you doing? Where are you at? What medications you're on or whatever, and then they send all that information to the CDC, and they make sure that that communicable disease, they follow the path of that and make sure that everyone's fine at the end of the whole thing.
Government regulations.
Right.
But I understand that, but it's also government regulation for the people who are delivering the services. So they get it 2 ways.
Right, they probably do, right, but as with all boards of health, we're charged with that, so we have to have a record also.
So they could go to a hospital in Fall River or New Bedford and say there's a communicable disease case, but then they want to know that where they are, where they live, that they are following up and doing what's correct.
They know the zip code and everything else. I mean, they
You
can
have to report it.
pin it right down.
Yep.
Yeah,
So-
it's redundancy.
These are visiting nurses?
These are visiting nurses, yeah. It's a visiting nurse association, but in that association, we have somebody that we call when someone needs a particular vaccine, or someone has a medical condition and they're concerned about it. We'll pass it over to them. There's a lot of different things, because of HIPAA regulations, I can't go into them, but there's a lot of cases that have to be dealt with a nurse or a nursing association. If we were to hire a nurse, it would be a lot more than $16,000 a year. So in addition to that, we pay for a nurse to be here once a week in the Council on Aging office. And they take blood pressures, they take blood sugar readings, and they also administer medications for, as all local boards of health do, if they have a nurse in their office, someone would come, and if they need medication for a certain thing or a shot to control some certain disease, they do it here. So that's why it's important to have that weekly. it has been...
That's a good idea.
It used to be more frequent. We had it a couple times a week, but because of budget restraints, we've had to cut that. So that's included in the 16,000. Printing, mailing, and postage, we're asking for more money. I can tell you that just the postage and some of the mailing for the regulations that have changed, and if someone doesn't pay, for instance, or they need a copy of the new regulations, you have to send out, or registered mail. All these complaints generate a letter to them and to whoever's involved, and that's registered mail. So I think last year we paid hundreds of dollars in advertisements alone. I think one advertisement was $800, because in the last year or so, we've upgraded our nitrogen regulations, we've updated our tobacco regulations, and we instituted a new synthetic drug bylaw, which was necessary in this town. They were selling the synthetic marijuana, which is just some type of herb treated with some type of hallucinogenic. And they buy it from companies, these stores buy it from companies, and they sell them for 4 times the amount that they paid for them. And I'll give you an instance, and this is not a good thing. The week that we did this, I got a call from the police chief. He said, "Do you realize that 5 girls last night were taken to the emergency room, and one was sent to Boston by helicopter in critical condition for smoking this stuff?" So that's why the Board of Health acted, and that's why to advertise these things, it costs money. So printing and mailing, that's advertising. That's still low because we've spent a lot more money on advertisements and new regulations. Office supplies, that's about where we should be at $2,000. We don't squander or spend anything extra. We do the best we can with that. Vehicular supplies, that's, as I told you before, if we need something like tires or something like that, we get charged back on that. Gasoline, gas and mileage, we've raised that because we have 3 inspectors, including myself, and we're scrambling, and we use my vehicle, and we use another town vehicle, and the mileage adds up when you're going all over the place for...
Go ahead, Tom.
Where do you get your gas?
We get our gas at the municipal maintenance.
Good.
It's registered there by virtue of some electronic device.
Yep.
I guess that's about it for the budget. I can tell you that we hope to eliminate some of that gas and mileage fee by renting a vehicle out of the $50,000 that was allocated to the Board of Health for use for the housing inspection program. We're hoping to, and this was Mr. Sullivan's suggestion at our last meeting last week, was that we use some of that money to rent an inexpensive vehicle that gets good mileage. And we can also charge that gas to that account. So that's what we intend to do, and cut that bill down a little bit. And we're doing the best we can. We've always had, it's always been when I got there were a lot more employees in the Board of Health than there are now. And there are a lot more things that we're charged with than there were now. You know, we have to do something for the state or the CDC every week for disaster preparedness, or, you know, we're not looked upon in a good light. So that's, we're very active in there. We're very, I have a very active board who is not afraid to change regulations that we need to make a move forward in the right direction. So that's about it. Mr. Chairman, if you or your board have any questions, I'd be glad to answer them.
I just have one. On the 2 positions that have 19 hours, do they get health insurance through the town?
No, they do not. The one on the sheet there, John Viveros, he's retired from the DEP. He's got his benefits. The other 19-hour person does not get any benefits.
I like your enthusiasm.
Thank you.
Well, I guess I won't ask that question. I won't ask it, no. I'll get you, I'll drop by later.
Thank you, Tom.
Fine.
We appreciate that. I think you've answered the questions thoroughly, thank you, I appreciate this. Obviously, there's a reason why we have a Board of Health. And again, like most of the departments in this town, I think you're doing the best that you can. You're doing a phenomenal job with what we've given you. Is this budget adequate for you to function? Can you live within this? Is this realistic? Your boss is sitting next to you, so I know you have to say yes, but...
And that's the thing, we talked about it, there's no consideration of me here. They need to be able to express whatever they
Right,
want.
I mean, that's...
Right, I don't feel intimidated to answer your question.
We're all sitting, yeah. Which is silly.
Here, let me get the gun out underneath it.
I mean, we're all citizens of this town. We're all taxpayers in this town, so we're all in it to some extent. We're all in it together. So, on the one hand, we're trying to maximize services and minimize expenses, but we need the services that we need too. And we are also trying, as a committee, trying to improve the town overall. So, that being said, what are you really missing?
Well, we are missing a couple of full-time people. We need another full-time inspector. I've talked to Mr. Sullivan about this, and we're going to be putting the 30-hour person on 40 hours through the housing inspection program. So I'm getting a little light on the 50,000 because I need all these things, and they all have to come out of that account because there's nothing there. If there was money, I'd need a full-time inspector to help with the efforts.
I don't want you to think there is money.
No, I know, I
Don't get
understand.
me wrong there, but if there were, that's...
That would be what I would need
Okay.
to do the job and do it. I mean, I can say from my staff, we do our job, we do our absolute best every single day because it's a challenge. If you ever want to come and sit in my office and just listen to what, it's the busiest Board of Health. Some of the people from the Department of Public Health are in there on certain things, and they tell me I've never seen, at meetings with the state, they say I've never seen an office as busy as this. It's just constant. There's more issues in Wareham from substandard housing. A couple of years ago, we were #1 for cancer deaths due to smoking. We're in the top 5 for pregnant teen smokers, so we've made a big effort with grant
Shh,
money.
we don't want to be advertising those facts. We're trying to improve the image of the town. Come on.
No.
Seriously.
Well,
I
I'm just
appreciate
telling you, on the
But
Board of Health-
those are the kind of challenges that you're facing on top
Right.
of
Yes,
the other issues.
right. And we need, we got to keep moving forward, and I think this program is a good thing. I don't mean to talk negative about the town. These are just things
It's
that...
reality.
That's just reality, and I think most people know it. It's a challenge just keeping up with the restaurants. They all do a good job, but you need to get out there twice a year. We have 17 mobile home parks, manufactured home parks in Wareham. So that's a big challenge. A lot of them on sewer still, on septic still, so there's always issues with that. But I appreciate the opportunity to come before you, tell you what we're doing and how we're doing it. And I wish there was a pot of money that we could work with, but we're doing fine with what we got.
And we appreciate your work. Thank you.
Thank you.
Yeah, I just want to say thank you, Mr. Ethier, for the work you're doing and the professionalism in that office. So thank you.
Thank you.
All right. So let me finish this up. Because I don't get to talk most of the time. They go,
You didn't want to. You could have talked anytime.
I'm not going to talk much more after this because I'm tired. You are generating revenue with the inspection program. You are generating fairly good revenue with that program from what you're saying. It's 35 and it's costing you less than 30 to do it. So we're already generating that. But I guess what I'm saying is if you had the additional help and you could do more with that rental inspection program, would we generate more money? I mean, is that something we could look to as a revenue source to help fund some of what you're talking about as far as inspectors or the extra hours for the inspectors?
Yes, and that's what we're going to do with the 50,000. We're going to
Okay.
work with that. I believe it might take me a year to a year and a half on the first inspection, getting it off the ground, but we're going to accomplish that with the $50,000. I believe we're going to do a good job. We're going to get everybody registered, and then we can make the program meet our needs a little bit better. I think that you asked me if I thought that we could generate more money. I think that if we do generate more money, that would help the town. It would also release us from doing so many inspections from complaints. that we do now. So it's a benefit all the way around. And I hope that's the case, that when we exceed the 50,000, we can use it for other things towards the town. I think that, to be positive about the whole thing, I think if I was to say, if you were to ask me how I thought things were for the Board of Health as far as every major issue that we deal with, I would say that we're doing fine. We're keeping our head above water. We're making people comply with the regulations. We issue a lot of fines. We issue a lot of fines for non-compliance. I'm just hoping we can keep moving in the right direction, and I don't see any reason why we can't.
Thank you for your time.
All right, thank you.
I think Mr. Pichette requested, but they were done by administration anyway, so I can always speak about that. But if you'd like to introduce yourself and let them know.
Yeah, for those of you who don't know me, my name is David Pichette. I'm the Conservation Administrator for the town and work in the Planning Department, which that department is responsible for the administration of our local and state wetland laws, the zoning rules and regulations, and also the planning board subdivision control laws. So that's our major role, and we're certainly involved with guiding people through the permitting procedures, answering any land use questions that people might come in with to the office, things of that nature. As Derek had mentioned previously, there were several different budgets for the different boards that he's sort of now grouped all into the one budget. So that's why things might appear differently than they have in years past. So
It can cause someone to misfile. And if you go through this, you'll see the FY15 other fund. In the past, we've used what's it with the wetlands fees account? Is it
right.
Wetlands fees account? We've taken money out of that to subsidize Mr. Pichette's salary. It's that's an account that's running lower and lower, and we have to check on it. And I don't know if we'll even have the 15,000 available. But that's we used to take out 25,000. We need to really limit what we're doing on that, because while the usage of his salary is a proper usage out of that account, there could maybe be some other things that could be done.
Do we know why that account is running lower?
Well, first of all, the balance of that account is $20,713.40 as of November, according to Judy in the accounting. So there is the 15,000 in there. But what that account results from is filing fees that we receive from permit applications. So from year to year, you never know how many applications you're going to receive. Therefore, the number of fees varies from year to year. So you never get a fixed number. Some years it's a little higher, some years it's a little lower. But typically, it's not as high as 25,000 a year. So as you're drawing that much off for several years, the account's just going to drop. So.
All right, do we have any questions here? And I guess I'll just start by, I did ask that we don't have a town planner. Derek, are we going to have one for next year? Is that?
Yes, we're going to have one.
We're going to be positive about this. Yes, we are. Okay.
That is the plan.
All right, the rest of the budget seems pretty straightforward.
Marilyn, excuse me, can I
Go ahead.
ask him what professional services are?
Professional services, from time to time, there's need to have engineering consultants come in or other consultants to review projects that we're dealing with, some of which might be older projects where we need to get, let's say, for example, a road construction examined by an engineer to determine whether or not it's completed according to the plans. If the people that had done the road or a homeowners association wants to get that road accepted at town meeting, it has to have certain approvals before it can get to that point. So from time to time, we do have to bring in other professionals to do that work.
Go ahead. You can ask it.
You know, we heard municipal maintenance talking about the state mandating cleanup of the outfall pipes that go into the water. And is conservation involved in that at all? Have you heard anything?
We are involved to a certain degree in that, in terms of stormwater regulations, we have to be up to a certain code as far as that goes, which we have. The state stormwater standards are up to speed with the requirements of that. So we're involved, obviously, with permitting of new projects, making sure they meet the standards that they need to. And any upgrades that have to be done might have to be reviewed by the Conservation Commission as well as part of the permitting process.
Okay.
I think that was pretty quick and easy. If there isn't a whole lot else to be said, I just don't know if Derek wants to address the need for the town planner. I don't know if the newer people were on board when that, you made that argument, if you need to make it again.
Yeah, I think they were. One of the things is, you know, we are a large town. We're trying to cultivate the type of planning and building that we want. And having a part-time planner, just, it didn't work. They were serving two masters, so to say, another municipality and ourselves. And I think we are really shortchanging the town. Having a planner that can also be on board for the future planning, such as the master plan and such, it's really going to go a long way to directing the town for the future and really steer us where we want to be. So, you know, it just didn't work out as a part-time position.
And I'm totally appreciative of that. Hold on just a minute. Working in the real estate field and understanding the legalities of real estate law, you can save yourself a good chunk of legal fees if you have a town planner who is knowledgeable and just does it right from the beginning. So that's a good thing. Judy, did you want to come up and speak?
I won't leave this time.
I just want to reinforce the need for a town planner. Because of one of the selectmen, there were some planning articles that got put before the town meeting in October, but without that person, or actually there were two of them who were doing a lot of work, those bylaws would not have been presented to the town meeting. At the moment, because we do not have a planner, there are opportunities that are
Being missed.
being
Let's say
missed.
that.
Yeah. And while we are working on a TDR bylaw, it really is not something that the selectmen should, we can be interested in it, but it really is really important. Really, really one more big time important.
Preaching to the choir. Thank you very much. We good? Yeah, we're good. Wow, we're good and we're fast. Thank you.
All right, thank you.
Oh, sorry, Joan. You got to be louder, louder.
Do we have any applicants?
Yes, we're going through the interviewing process.
Great.